Hey everybody, it's your favorite psychologist here. And one of the number one questions, or one of the top questions that I get is, can you refer me to a therapist? Can you tell me who you recommend for therapy? And I always have questions, not because I'm nosy, but because it's really important to think very intentionally and strategically about who the provider is. So one of the things that I ask is, who's the therapist for? And I ask that question because even though someone might say they have expertise or they've worked with both adults and children, if you want someone who really does have expertise, they tend to work with a particular age group because we can't just think of children as little adults or adults as big kids, even though that may feel true at times. If you want to work with someone who can be most helpful, they tend to specialize with a specific age group. So I will tend to ask, is this for a child, for an adult? Who's this recommendation for? I'll also ask what the problem is. And to be honest, it's fascinating for me when someone says, I need a therapist. And the reality is that in the same way that providers have expertise in working with specific groups, they also have expertise in working with particular kinds of challenges. So someone who, wants to stop drinking and needs help drinking and maybe AA hasn't been enough. They need to work with someone who has more substance use expertise. Not always, but it can be really very helpful. Someone who's just having issues with their entire family and the family is ready to get help. They want to see a family therapist who can talk about systems and dynamics in the family group and entity. And that's important because those of us who have expertise in particular areas are more able to see a problem or situation, diagnose what's going on, or figure out the cause of what's going on, and develop a treatment plan or a game plan to help you learn how to manage or deal with whatever it is that's going on. So you want someone who has more expertise in the area that you're struggling with. Now I get it. A lot of people just want to feel better. Like they don't know what's going on. They don't know what kind of professional to look for. But one of the things to think about is, at least at a basic level, finding someone who has diagnostic ability, who can assess pretty strongly based on what you describe is going on. So, as an example, I identify as a cognitive behavioral therapist. I train doctoral students in cognitive behavioral therapy. We have a strong dimension in understanding how thoughts connect to behavior, connect to feelings. And so when we understand a problem, or the way that we understand a problem is to try and figure out what are the thoughts that are connected. Not to say that the person is wrong or not thinking about something the right way, but maybe they're not thinking about a challenge in the most helpful way. And so that's our approach. And it's evidence based. And that leads me to the, I think, third point is, ideally you want to find someone, especially when the challenges are more longer term, like months and years, and especially months and years pre-pandemic. It's really good to be able to talk to someone who engages in an evidence-based practice. That means that there is science that shows that what they do actually works. Now, there are some people who really just need someone to talk to, because that's not what all therapists do. Like, therapists ideally are helping people find solutions to address their challenges. There are some people who have more short-term or acute emotional difficulties, and they feel like they either don't matter or they haven't been heard. Those individuals may want someone who is really just going to be able to listen to them objectively and find support and let them be heard, and to maybe get outside of their head a little bit so that they can just feel a little bit better and feel more supported and not so isolated. And those individuals provide supportive therapy. So, think about what it is that you want from therapy beyond just, I want to feel better. Because if you can think very, or as close as possible to what it is that you want to get from therapy, that will help you better identify who the provider is who can best help you. So I hope that's helpful. Drop some comments in the box. Let me know below if there's anything that I can say more about that could be more helpful. Be sure to subscribe to my channel on YouTube, and I hope you guys continue to be great. Thanks.